So, my name is Kiera Callahan. I'm 19 years old and I was diagnosed with Cushing's disease caused by a pituitary tumor. In my case, I had several tumors. So, I was experiencing a lot of different symptoms. I gained over 60 pounds in a year. My period was very off. High blood pressure, I was hypoglycemic. I mean, the list of symptoms just went on and on. I had the classic Cushing stretch marks on my legs and on my hips. And so my mom and I first were searching for a good neurosurgeon for a long time, and I Googled a neurosurgeon within our local area, and I found Dr. Lewis, and he had just such amazing patient feedback, and people just said that he was so caring and kind and intelligent. And so we made an appointment right away, and Janine took us in immediately. And he took one look at me and was like, I know what is wrong with you. You have Cushing's disease by a pituitary tumor. And that was it. So we were off to the races. We did IPSS testing, which is the only really true test that you can test for Cushing's. It's an inpatient procedure, so I went into Hoag and had it done. Mine was 8 on one side and 1,500 on the other, and it should not be above 50. So we knew immediately that there was a tumor on the right side of my pituitary gland. We scheduled surgery, and I went in, and the first surgery we knew immediately was not successful. My cortisol levels were supposed to decrease, and they did not, unfortunately. But Dr. Lewis was by my side the whole time, and he just really encouraged me, we will find out what is going on, and we will take care of it. And so within 2 weeks, I was back in the hospital. We knew we had a pretty good idea after the first surgery of where the tumor was located. So we went back in. Dr. Lewis went through my pituitary from like one side to the other, and we found 2 tumors that were causing my Cushing's disease. And immediately within the first 24 hours, my recovery was so much different than my first surgery. I was up walking, my appetite was better, my pain levels were significantly better, and I just really had this feeling of we got it, and we got what we were looking for. My recovery from my first surgery was not that great, and so compared to the second surgery, it was amazing. I felt like a totally different person. I went home from the hospital within, I think 3 days after my surgery. And I've been recovering ever since. I switched my major to pre-med, and so I'm taking classes. Right now I'm taking 2 classes with the sign-off of Dr. Lewis and my endocrinologist, and just really enjoying it and starting to feel better. I know my recovery is a long recovery. It's up to a 2 to 3 year recovery from Cushing's disease, because it takes a long time for your body to kind of readjust after your hormone levels come down, and for your body to realize that it can start to function again. But so far I'm feeling pretty good and excited about the future in front of me.